Abnormal uterine bleeding or heavy menstrual bleeding accounts for 25 to 30% of the gynae outpatients consultation, and it is a very important problem because eventually if it is ignored it can lead to anemia, lassitude, tiredness, and sometimes the patient they come with hemorrhagic shock. So I am Dr. Usha Bohra, head of the department, Apollo Hospital, OBS and Gynae. The causes of abnormal uterine bleeding can be divided into the pathology of the uterus itself or some non-uterine causes. So the common causes of the uterine factors are a polyp in the uterus, a fibroid in the uterus, adenomyosis in the uterus, rarely cancer in the uterus. So some are benign causes and cancers are a different ball game altogether. Then other causes are some patients who are suffering from coagulopathy, which means that they have disease in the blood coagulating system, they have underactive thyroid, or they have hormonal imbalance in the system, which can also lead into heavy menstrual bleeding. Normally a cycle occurs between any cycle which is from 21 days to 35 days, and the lady bleeds for 4 to 5 days is considered as normal. But if the lady bleeds, if the frequency of bleeding cycle is less than 21 days, or if she bleeds more than 7 to 8 days, or we cannot calculate the amount of blood volume which is considered to be more than 80 ml per cycle, it is very difficult. But if the heavy menstrual bleeding leads to anemia, it is called abnormal uterine bleeding or heavy menstrual bleeding. So how do we know that this lady is suffering from abnormal uterine bleeding? The three most common tests which are routinely done on such ladies are a complete blood count, which means that if a lady's hemoglobin is less than 12 gram%, she is suffering from abnormal uterine bleeding. However, we have to rule out other causes of low hemoglobin. On a trans-vaginal sonography, if she has adenomyosis, a polyp, a fibroid, or any other uterine cause, then also we can correlate this sonography finding to abnormal uterine bleeding. Hypothyroidism or thyroid dysfunction is one of the most common cause of abnormal uterine bleeding and accounts for 10% of the cases of abnormal uterine bleeding. In young adolescent girls, when they start their periods, so initial 2 to 3 years, in their periods, the cycles are anovulatory, which means that during these cycles, the ova are not produced, and because of high levels of hormones, particular hormone called estrogen, their cycles become unusually heavy, they become anemic, they have poor performance in the school. So how do we deal with these problems? It is not necessary that all patients should have surgery for abnormal uterine bleeding. The most common thing is, number one, is to correct the anemia and give them iron supplements. The second thing, which has been recommended by the Royal College of Obstetricians and Gynecologists, is when the lady has heavy bleeding for 3 to 4 days, during that period you give them a combination of anti-inflammatory and a hemostatic agent, which we called Texakind MF or other combinations, for 3 days, and it relieves heavy bleeding in 70% of the cases. Where there is hypothyroidism, we correct the thyroid disorders. Where there is a coagulopathy, we correct that. And eventually, if the lady is more than 40 years of age, if she has fibroids which are causing heavy bleeding, we take her for a total laparoscopic hysterectomy. If she has a polyp inside the uterine cavity, she does not have to have a hysterectomy done. We can do a simple day case procedure called a hysteroscopic polypectomy, wherein we put a camera inside the uterus and we take out the polyp. She goes home the very same day and she is relieved of her symptoms. For cancer, the diagnosis and management is totally different, so we are not going to talk about this today, maybe some other day.